Real cause of high blood pressure. In today's video, I'll be talking about hypertension or high blood pressure. In the medical field, the term used for this purpose is hypertension, which has two types, primary and secondary. Secondary hypertension occurs due to some other medical condition. For instance, if someone is undergoing kidney dialysis or has another kidney disease, a hormonal disorder, or is on medication for a long period, it could lead to secondary hypertension. High blood pressure can also be a type of primary hypertension, also known as essential hypertension or idiopathic. This means the cause is unknown. It's said that idiopathic means the cause is unknown, and 95% of people who have hypertension, it's this. It's often advised to cut back on salt intake. It's suggested that your blood pressure might be high because you're consuming too much salt, so cut back on salt intake. And in some cases, diuretics are prescribed again or other medications. Metabolic syndrome, which includes high blood pressure along with high cholesterol, high sugar, belly fat, and insulin resistance, is a mix of all these things, and it's quite interesting. If you read about just insulin resistance, you'll be surprised to know that high blood pressure is a side effect of insulin resistance. Or it's better to say that the issue with high blood pressure is occurring due to insulin resistance. Similarly, in metabolic syndrome, all these things, high cholesterol, high blood sugar, obesity, belly fat, are symptoms of insulin resistance, indicating increased insulin in the body. However, this gets quite confusing because whenever this is discussed, insulin resistance isn't given much importance initially. It's often considered as an associative factor in the end. While the truth is that insulin resistance is the cause of all these diseases, including blood pressure, because the main problem that occurs in the body due to insulin resistance is that the arteries become stiff. This is called atherosclerosis. When the blood vessels are hardened, the blood pressure will increase because blood pressure is the pressure of the blood that it creates when it hits the walls of the blood vessels. The analogy here is that it's like a water pipe. If the pipe becomes stiff for some reason, or toxic substances start accumulating inside it, or its opening gets narrow, then water passes through the pipe with pressure. Similarly, when insulin levels are high, it also becomes a cause of sodium retention in the body. The body holds on to sodium, and with increasing sodium retention, potassium decreases. The balance between sodium and potassium is crucial, and when there's a deficiency of potassium, it becomes a cause of high blood pressure. All these factors are interconnected. From the perspective of insulin resistance, I don't think your excessive salt intake is the reason for your high blood pressure. Potassium deficiency might be the reason. Because our body needs about 4,700 mg of potassium daily, and to get this potassium, you need to eat a large portion of vegetables or salad every day. If you're not taking potassium in supplement or any other form, people may have stopped eating vegetables, and you might be doing the same. But the real reason is insulin resistance. This topic is different from the topic of blood pressure, so I'll explain more at the end of the video. Insulin resistance also hinders the absorption of potassium in the body. The body can't utilize potassium properly, which causes the level of sodium to increase. As sodium levels rise, blood pressure increases. So, there's a cause and effect relationship between the two, where one leads to the other. And there's always been confusion on this topic. Now let's talk about insulin resistance in simple terms. It's the body's defense mechanism that arises due to the increase in sugar levels in the blood, caused by carbohydrates or high-calorie intake in food. After going through the process of digestion, glucose is converted. This process occurs in the large intestines and small intestine. Then, this glucose is absorbed into the blood vessels present here and enters the bloodstream. When glucose is detected in the blood, the pancreas releases insulin hormone. Insulin then takes this sugar out of the blood and transports it to the cells. Here, this glucose is converted into energy, which the body then utilizes. Now, the job of insulin here is to prevent the blood sugar level from rising too much. Too much means it's almost 100 milligrams per deciliter. The fasting glucose level shouldn't be more than about a teaspoon. If we talk about the total volume of blood, meaning the amount of sugar an average person needs, it depends on their activity level and daily tasks. Now, if someone is consuming more sugar than necessary, eating more than required based on their daily activities, then excess sugar is produced. And when this extra sugar is taken to the insulin cells, the body's cells reject it. They refuse to take it in, resisting insulin, and this condition is called insulin resistance. The average American adult, teenager, and child consumes about 17 teaspoons of added sugar a day, or about 270 calories. This is an average number, and annually, it adds up to about 24 kilograms of sugar. Now you might easily understand this, while our bodies don't actually need this much sugar. The question arises, why is this so? And why does the body exert so much effort to keep blood sugar levels below 100? This is because if this continues for a long time, with sugar levels constantly rising in the blood, body organs start getting damaged. This includes neuropathies, which refer to damage to the nerves. Damage to the nerves in the hands is called neuropathies. Nerves, including those in the feet, which are common in diabetics, are referred to as peripheral neuropathy. Damage to the optic nerve can lead to vision impairment, heart disease, stroke, and diabetes. If we understand it as Moore explains, there are three main components in our diet: carbohydrates, proteins, and fats. Carbohydrates are directly converted into glucose or sugar, and it's a myth, a misconception, that the body's favorite fuel source is sugar. The question arises, if someone isn't consuming sugar or carbohydrates, how will the body function? The argument presented is that since the body needs both protein and carbohydrates for energy, it can still function properly even without sugar. In the body, carbohydrates are chosen first for fuel. If given the choice, the body will use carbohydrates first, then move on to protein. It's a misconception that carbohydrates are a better fuel source than protein. The truth is that the body prioritizes sugar because it's more damaging. Having sugar remain in the blood for extended periods is not good for the body. As soon as sugar enters the bloodstream, the body goes into emergency mode and then needs to dispose of it quickly. That's the real reason behind it. It's not that the body prefers sugar, it means it's dangerous. So, as soon as possible, get rid of it. Then it's sent to the cells, stored in the muscles as glycogen, converted into fat. In other words, it's transformed and stored in a different form for emergency use, mostly as fat. Then the energy derived from sugar is a quick source, short-term, whereas stored fat, it's more. In a normal person, around 40,000 calories of stored fat. The body prefers fat for long-term and sustained sources of energy. Its functions don't stop. If you develop a habit of using fat, because sugar isn't immediately available, it takes about half an hour to an hour for the body to adjust. After a while, hunger sets in, and something needs to be eaten for energy. Then we start consuming sugar in the form of bread, pasta, cereals, biscuits, pizza, processed items made from flour, cold drinks, and unknowingly, many people do. Many individuals are pre-diabetic, standing at the threshold of diabetes. The disease of sugar could strike today or tomorrow. How many people have already been diagnosed with diabetes? How many have insulin resistance? On the other hand, when you shift towards fat burning, you're providing your body with another type of premium fuel source called ketones. Ketones are the byproduct of fat burning. The product is efficient, and up to 85% of the body's functions can work very effectively on ketones. Only 15% of body organs require glucose, including the brain, lens of the eye, red blood cells, and sperm cells in males. But here's the catch. Even this 15% can be made from fat in the body, whether it's stored fat or the fat we consume in our diet, and when needed, the protein we eat can also be converted into glucose by the body. So, there's no need for added sugar or extra sweetness. The process of glucose being made from fat is, they call it gluconeogenesis, and it happens in the liver. During this process, the waste produced is less sugary than sugar itself. It requires less oxygen and is less stressful for the body. So, to recap this video, insulin is actually a detoxifying hormone, while sugar is toxic. Insulin resistance is the body's defense mechanism against extra sugar. Eating too many carbohydrates shuts down the insulin hormone in the body, causing sugar levels to rise, which could lead to various health issues. I hope this information proves beneficial to you. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.